Imagine looking people confidently in the eyes without worrying about your hair.
3,000 and more clients, and our successful results are 98%.
Antalya's top hair transplant expert is here, revealing exactly how it's done, affordably. By the end, you'll have answers to all those questions holding you back.
Hi, my name is Asli Bağlan. I'm coordinator here. We are making the hair transplant operations with the latest and newest technology. We are doing the operations with the certificated staffs. In this hospital, we made 3,000 and more clients for hair transplant, and our successful results are like 98% for hair transplant.
Do you also happen to have women patients?
Yes, we have too much women patients.
Where do they come from?
From everywhere.
Do you get mostly young patients or also on the older side, like maybe 56?
The middle age, we can say.
So if somebody who would like gray hair implanted, transplanted, somebody in the age of 55, 60, how would you treat them?
We have patients like 80 years old. 70 and more. We have too much clients like this, and the results are not bad. Just maybe normally when we transplant for a young person, 2% maybe we can lose the hairs. But after 60 years old, when we transplant, let's say 4,000 grafts we transplanted, maybe 10%, 15% we can lose because of the, hormones, because of the blood, body system. It's, after 60, it's a little bit low. So losing hairs can be a little bit more. That's it, but the results are not bad. We are using DHI, means direct hair implant technique for the hair transplant operations. And with this technique, the results are very successful and the patients are very happy.
Maybe you could talk about, what DHI is, who is a good candidate.
Okay. We are using DHI technique for the operations for transplant, and DHI is the newest technique for hair transplant. With this technique, we are not transplanting the grafts with manual. We are using a half robotic pens. We are putting the grafts one by one to the pen, and at the same time, we are opening channel and putting the grafts. So with this technique, density is very good, like for 1 centimeter, like 80, 90 grafts. And the natural looking is very nice with this technique. We can use DHI technique for all the clients.
As long as they have hair and roots.
Yes, sir.
So for example, I'm an international patient looking to get DHI done here. What would you require beforehand, before I come in, to ensure that, I can get the procedure done?
If you are a client from the abroad, what you must do before come here, I will try to explain. First, we must know the health disease before operation, because not all the clients are suitable for the hair transplant. The health disease are very important for this, so first we must know this. The second one is we must see the hair before operation 100%, and if you need to stop some medicines, we must know this. When you come here, we make your blood test and we check your blood for are you suitable for the operation or not.
So what does the treatment plan look like? How many days should I plan my trip to Turkey?
Okay. When you come here for operation, you need to stay minimum 2 nights for the operation. First day, we will make your operation. Second day, you will take rest. Third day, we will make your first washing, and at the same day, you can fly.
So on the first day the surgery happens, how long is the procedure for?
Okay, hair transplant operations takes like around 6 hours.
after evaluation, do you give a treatment plan of transplant as a whole, or do you also decide then on number of grafts that the person needs?
Yes, we are giving the grafts number. Before he come here, of course, we have a plan. We are giving him. This plan is like 95% accurate, matching. Maybe sometimes we say 4,000 grafts. And when he come here, maybe we can take 4,000 and more grafts from the patients. But 95% it's matching. Of course, all the day we are making a plan and we are sending to him.
What's it the most number of grafts that can be transplanted?
In one day session. In one session means we are sometimes for one session we are making the operation in 2 days. We are taking from the head and we are taking from under the chin. So in one session, in 2 days, like 7,000 grafts maximum, sometimes we are transplanting.
What is the post-op care? You could mention these are the things that you need to take care of. And once they fly back to their country, how do you follow up with?
Okay. When you go back to your country, we are checking you on WhatsApp and you are sending us all the time the pictures. First 10 days is very important for the operation results. So first 10 days, every day we must keep in touch and you must send your pictures to us.
Are there any precautions that they should take post the surgery?
After operation, 2 days is very important for us. In these 2 days, you mustn't touch your transplant area to anywhere. First 2 days, you mustn't put a hat and sweating is very important. You mustn't sweat for 2 nights. When we make your first washing, you will be relaxed and scabs will be gone in 5 or 6 days. So it means after 8 days, everything will be normal. The first washing is very important for us. We want they stay here. We are showing how they are washing the hairs, like 5-6 days.
Is there like a special shampoo for it?
Baby shampoo, we are using baby shampoo. And for the scabs, we are using body lotion.
Only for 6 days. After that, they could go back to the normal shampoo.
After 3 months, they can start to use their own shampoos. But 3 months, they will use baby shampoo.
When you keep in touch after the procedure, then there might be maybe 1 or 2 in 100 that are not satisfied with the kind of results that they see maybe a month or 2 months later. So am I supposed to come back, or how does that situation need to interpret?
Of course, we don't have 100% successful results. If I say this can be a lie. But our statistics says 2% clients come back here and we do them the revision operation, the free.
So when they come back, it's of course free of charge treatment, but they still have to pay for their transport coming here.
Yes, sure. Just operation is free. Of course, they will pay the flight, hotel, and the transfer.
Well, what if they can't make the client?
Can they reschedule from the same deposit?
If we have the deposit, they can reschedule, take a lap plan.
Of course, of course.
Are there any downsides of the DHI technique? Any risks associated with the technique that you perform?
Hair transplant operations are generally no risk.
I'm just looking at the reasons what could make a graft to fail.
When they have the graft and put it into the root, when the surface is little, the tissue is little, there is a higher chance for it not to, hold. So if it's a bigger tissue, then it holds better. So the results will be better.
Can you also share your previous patients before after photos with the new ones coming to you so they see the kind of results they can expect?
Yes, we share with them.
In the past, we have had a kind of a comment from one of the patients that how can I trust this before and after, because I get this from my own AI later.
Oh yeah.
Anything that you can make, authenticate that photo, or maybe you can put your new patients in touch with your older ones just to,
Oh yeah.
so it's an authentic one. Can you also do that?
Yes, sure. The clients who is coming from the abroad, sometimes they want to talk with the old patients. Maybe he is coming from England and he wants to talk with someone in England. So first we are talking with the old patients, and of course he must know this, and we are giving the telephone number and they are contacting with each other.
So people, when they see their hair receding, what is a good time for them to go for hair transplant? Can they afford to delay it? Can they afford?
Okay, the age is of course important for hair transplant, because until 35 years old, the man has hair loss. So if a patient come us for hair transplant, if he is maybe let's say 20, first we are checking, does he has still hair loss or not? If he has hair loss, of course we say maybe you can wait 4 or 5 years. We can see the result, what's going on with the losing hairs. So we cannot say to all clients, okay, come here and we do.
So you need to evaluate the case first and then you pick your.
Yes, sure.
So you mentioned that it usually takes them 3 days here, 40-day surgery, then recovery, then hair wash, and then 8 days everything is normal. How long after that can they expect their head to be fuller? And by your progress,
6 months?
the gradual progress.
When we come to 6 months, like 70% will be grown, and when we come to 1 year, 100% we will see the hair.
Would it be possible to compare DHI versus FUT or FUE?
There are two methods to do hair transplantation. One of them is called channel method, the other one is called DHI. We prefer to use the latest technology, which is DHI. There are a couple differences between two methods. Channel method is getting done manually, and the results are not the same as DHI, because when they do the manual hair transplantation, the roots are not close together. So they're mostly, the density is not accurate. So the hair roots are not tight enough when we do the manual method, which is channel. There is also differences based on medical terms. There is a higher rate of getting a necrosis or an infection if they do the channel method. DHI method is better in our opinion, because for us to have a natural result and also have a tighter hair roots, it's the best method to use.
What's the difference between the whole process? I mean, from starting with evaluation to post-op with men versus women?
Yes, the procedure is same, because we are taking the grafts from the back and we transplant to open area. But the women are a little bit different from the men's, because when a man come here, we don't ask why you have hair loss and something question like this. But if a woman come here, we ask too much questions, because women don't have hair loss normally, Maybe she has hormone problems, maybe she has problem in the blood. This is just an example. And so we must ask too much questions before the operations, and we must know why the lady lose the hairs. If we don't know, maybe we cannot do the operation.
How do you compare those with other techniques in the market? For example, PRP, laser therapy. Some people might think PRP is a good alternate.
Yes.
What would you say to them that why should they go for hair transplants instead of PRP?
The PRP is different treatments. So PRP is exactly, we are using it for the hair loss. when you make PRP, what do you lose? It's not working on the losing hairs. İrem gerçekten.
What I understand is if somebody comes to eat, they have hair loss, then you treat it with TPRP. But then if it does not do any good, then the next step would be transplants. Is that right?
Yes, but the PRP is not a magic.
Yeah.
So just if you make with the sessions, minimum 4, 5, maybe we can stop your hair loss. Just this. So PRP little bit feed the grafts. If you need hair transplant, if you need really open area, the PRP doesn't work. The PRP, maybe it's nice to do it after hair transplant operations. So it's for new hairs,
There are a lot of stories when patients come to us, they say that they have tried this clinic, they have gone there and the hair transplant is botched, it's not a successful one. Can you also fix those cases?
Yes, sure. We say revision operations. So we are making too much like this from abroad and from Turkey. Patients made the operation before 1 year, 2 years, it's not important. And the result, if the result is not good, and if the donor area let us to take new grafts, we make the operation with the successful results.
Is there a reason you chose to become a hair transplant surgeon?
To change a person's life is the thing that she's doing this, because to see the before and after results is making her happy and also making the clients happy. That's the reason that she's doing hair transplant.
Sorry for my English. I couldn't answer all the questions. İrem gerçekten.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.